Hi there. Wanted to talk to you about this medication area inspection record. This inspection form serves two criteria. Number one, it's going to help you to go through every area of your monthly inspection without missing anything. And it will allow you to do it very efficiently. And the second reason that you need this form, this is a form you will leave with the facility. You'll leave a copy of this form with the facility in the event of an state audit, that they will see that you, as a consultant pharmacist, has been in the facility and what you have done, what you found. So this is very important. It really all comes down to this inspection sheet. So you have your client, you've arrived at the facility for the first time, you've met up with the director of nursing or the administrator, they know you're there, and now you've answered all their questions, found out what's going on, if there's anything that needs special attention. And now you're going to be doing the part of the work that you're there to do, which is to inspect the facility. So let's go through this quickly. So generally what I do, I would write in the name of the facility that I'm working with here and the date of the inspection that day. And then we have the inspection criteria. So you would go and find where medication is stored. You can ask the nurse or the administrator or the director of nursing, say where the areas. I'm assuming this is going to be your very first visit to the facility. You want to know where in the facility are medication stores. You want to find those areas and make a note where they are, so when you go back next time, you don't have to ask that question. And you will check for expired medication, recalled medication, or if you see a medication that doesn't look like it can be used in a safe manner. So that's what you're looking for. But mostly the number one inspection deficiency that's found for medication management services in surgery center are expired medication. So I focus heavily on that. And in a later training, I have a form and I will show you how I track medications that are close to being expired and how I literally help the facility to never ever have a medication that's expired on site that's there for general use. Then the second item, we're talking about making sure that only authorized drugs and supplies are present. And so what does that mean? Well, authorized drugs means, for example, if the facility are working on eyes, it's a facility for cataract surgery, retina, just a facility that does eyes, then they should not have medication in there that are used for colonoscopy procedures, because you shouldn't be seeing scopes or medication that they use for colonoscopies there, because that's those items are not authorized to be there for the services that they're offering to patients. Sample drugs, you want to make sure if there are any sample drugs that they are stored appropriately and that they're identified as sample medications. But honestly, I really have never seen that, any sample drugs. Actually, one time I did see some ibuprofen and some Advil in the medication, and it did say sample on it. So yeah, and making sure that those sample drugs are stored appropriately. Also, drugs that require special storage conditions. So, for example, medications that need to be refrigerated, make sure that they are in the refrigerator. You don't want to see medication. So, for example, some forms of famotidine injection is stored, has to be stored refrigerated. And if you come and it's stored in the cabinet, then, and when you look at the package, it says must be stored in the refrigerator, then it needs to be discarded because it was not stored appropriately. You want to make sure that your facility are managing recalled medication, so there needs to be a system in place. Generally, there's a binder for recalled medication, and in a later video, we'll talk about how those are handled in the surgery center setting. You want to make sure that medication vials are not reused if they're single use. So if you find a vial in the medication storage area and it has a beyond use date on it, and you look at the vial and it says single use only, well, that needs to be discarded right away, because if it's a single use, once it's punctured, it has to be, the balance needs to be thrown out. You also want to make sure that on your multi-dose vials, that those have the beyond use date of 28 days on them. Another drug, I'll jump back up here and talk about medication being protected from light. So albuterol sulfate inhalation solution, those have to be protected from light. So if you go into a facility and they have albuterol and they've opened the little silver packages and they have them loose, you need to tell them when those packages are open. The unused nebules need to be stored in that fall pack out of light. Another thing is you need to check that medications are following the rule 797, the compound rule, where once you reconstitute something, certain medications in the facility needs to be used up within an hour once it's mixed and considered compounded. And so that's a whole nother area. If there's a bag sitting around with medication and it shows that something was added to it, then you want to make sure that the concentration of the reconstituted drug is on, that it's labeled appropriately. Another huge area is managing controlled substances in the facility. So we start by making sure that they're stored in a secure area. Secure area means that they're locked up. And generally in Florida, all narcotics have to be in a double locked area. So you want to make sure that they're secure. You don't want to walk into a facility and where the controlled medications are kept, that the cabinet's wide open, so anyone could go into that cabinet at their leisure. They're generally supposed to be locked if they're not, when they're not being accessed, and usually the keys are secured by registered nurses. Controlled substances must be securely stored and accounted for. So there's a book, and that is the only part of my inspection that I request that a staff person work with me. When we do the narcotic audit, the count, I make sure that I do it with a second person. So if there's a discrepancy, it's discovered by both of us. Also, you want to go through that book and make sure the anesthesia people, when they waste something, when they waste some fentanyl or some Versed, any controlled substance, that it has two signatures on the waste form. Emergency drug supplies must be sealed or intact, and all the medication you want to make sure is present and usable. So what you will do is you will crack the crash cart. You want to make sure that the breakaway lock on the crash cart, the number on that lock matches the log for the crash cart. They need to match. Then once you crack the lock and open the crash cart, you want to check all the medications in that cart, make sure there's nothing that's expired. Generally, what I found, a lot of the facilities with the medications in the crash cart, they will have on a log when the first medication in that crash cart will be expiring. However, I do check the crash cart myself because it's my responsibility to make sure there are no expired medication in that cart. Um, I check the refrigerator thermometer to make sure that it's within the range, which is 36 to 46 degrees Fahrenheit. And then I also check the log to make sure that someone is logging the temperature on a daily basis when the facility is open. So I make sure the log is present and that it is complete. I also check the refrigerator to make sure it's clean and it's not filled with excessive frost. No food or non-drug items are supposed to be stored in the medication refrigerator. We also want to make sure that the floor stock drugs are kept in locked storage or in a secure area. You will ask the nurse manager about where the DEA 222 forms are stored. Those need to be stored in a safe area. Um, you want to make sure that the crash cart, again, the cart is locked and is stored in an area which is visible. You don't want to be running down the hall, make a left, then a right, and find the crash cart in a room. It needs to be in an area where it's visible so it can be accessed in an emergency. And generally, you want to look around the area of the facility to make sure that everything is clean, neat, and well organized. One of the things that happens when the facilities are surveyed or the state comes in, if they walk into a facility and the area is clean, neat, and well organized, chances are they're going to, it'll give a perception of that we're following the rules. But when you walk into a facility and things are disorganized and messy, then they start to dig more because they figure, wow, if this place is this messy and not very well organized, then there must be more that's going on. So I always stress that to the nurse manager and let them know that if I find an area, I don't say to them, "Oh, you guys are really messy." I say something like, "I think this area could use some tender loving care, some TLC. So let's work on that." The last thing you want to do is to tell people what they're doing wrong. So I generally look for things, but we'll go into that in another video because that will be how you handle the exit conference after you've done your inspection. So let's move on. You want to make sure if you check the cabinets that they're not having disinfectants and externals. Any type of disinfectants must be stored in a separate area from internals and injectables. If there are flammable and combustible substances in the area, they need to be stored appropriately. Now, the facility must have a way where they can access weights and measure conversion charts. And most people will do that on their phone or they have a chart. Make sure that in the facility somewhere there's a poison control information center phone number that's hanging somewhere. Another area is how, in an effort to manage medication safely, you want to make sure that the invoices are available, pack and slip, making sure the pedigree is available for all legend drugs in the facility. And that's because the invoices, those need to be checked, especially the control drug ones, to make sure that as the drugs come in, that they entered in the log so that they can be tracked through the facility. They must have a procedure for contacting the pharmacist in an emergency, contacting you. The nurse, the administrator, the director of nursing, they have your business card. However, in your pharmacy book, which we will talk about later, you also want to put your contact information there and make sure that the staff there know how to contact you. Also, if they have a question, making sure that their antidotes are available. So if the facility uses, let's say, opioids, we must have some Narcan in the facility. Make sure that the formulary list or the drug list is available. Um, Make sure that there are guidelines for preparing and sterile parenteral drugs and solutions. Making sure that the nurse and staff know how to access um, interaction, contraindication information on medications, their perpetual inventory counts. Again, that goes back to the audit that we spoke about earlier, making sure that the DEA license for the facility is up to date, that the pharmacy permit is up to date, and any type of meeting that's required between the pharmacy and therapeutics committee. The power of attorney, make sure that's up to date, and that's basically as far as pharmacy is related, that the appropriate people who can execute the 222 form or any other services or any type of documentation that has to be done, that we know exactly who the person is that's in charge of doing that. Making sure that your pharmacy license is posted and up to date, that the nurses have at least two patient identifier system in place, and any unapproved abbreviation system in place. One of the things I do for my facility, as I go through, if I come across medications that will be expiring in the next 30 days, which they could be expiring before I get back there the next time, I make a list of these medications on my report. So let's say it's December 15th and a medication, it will be expiring January 1st. Chances I will not be there before January 1st. So I will tell them these are the medications that are expiring. I'll put them here. And I'll say, please make sure at the end of the month that you remove those medications. You don't want to remove them too early because you're hoping that the medication will be used up before that time and we don't have to waste it. In this section here, I would notate what I found as a summary. Generally, for this section, I will put facility is compliant with pharmacy processes. And of course, if there are any deficiencies, any areas I need to see them improve, I'll also make a note of it here. I would print my name, sign, and date. Again, this section here is where you would put your overall view of the findings. On the next video, since this video is a little longer, I will go into how you review this checklist with the DON, with the director of nursing and the administrator. Okay, thank you for listening.